Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Studio Arts and Glass and Genor Appraisals and Liquidations. Today, Brad and I are broadcasting from our administrative offices, and our special guest is Dr. Garcia, founder and president of Apex Dermatology. Good morning, Dr. Garcia, and welcome to the show.
Good morning, and thank you for having me very much, Paul.
All right, your skin is your protection. It's the very first line of defense for anything you come into contact with. For this reason, you should be adamant about maintaining its health. Whether it be skin cancer, acne, eczema, or aesthetic concerns, you should never neglect the health of your skin. Today, we're going to talk with Dr. Garcia about Apex Dermatology and their approach to treating skin conditions. We'd like to remind our listeners that our program is available on our podcast, so just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe.
Okay, Dr. Garcia, welcome to the show again. Please tell us a little bit about yourself and introduce yourself to our listeners.
So my name is Dr. Garcia. I am founder of Apex Dermatology. We are a medical practice specializing in general, medical, surgical, and aesthetic dermatology. I founded the first practice back in 2011. And the last 10 years or so, we've grown throughout Northeast Ohio to include now 12 locations all over, Northeast Ohio. We cover from Ashtabula to Lorain to Canton. So it's been a really busy 10 years.
Wow. Okay, so what services does Apex Dermatology offer, and what sets Apex apart from other dermatologists?
Well, that's a great question. And really the vision for me to open up the Apex Dermatology was try to solve the access to dermatology problem. I'm sure you have friends, or maybe yourself, somebody in the audience today probably has had a need to see a dermatologist. And when they call in, they give you an appointment for like 6 months from now.
Yeah.
So, I got tired of that. And I
Meanwhile, your skin's gone or something.
Right. Well, you needed something now, not 6 months from now. So, I really started Apex with that vision, to try to change that, the treatment and try to do a better job for our patients. So, at Apex, one of the big differentiators is that we see patients next day or same day. That's just part of our culture, part of our DNA. That's really a big differentiator for us. We're also very, very good at skin cancer. We've have a group of 3 Mohs surgeons, including myself, that have treated probably over 70,000 skin cancer between all of us. So I always tell people, when you have a cancer, it's important to kind of know your team, know that you have an experienced Mohs surgeon kind of in your corner. And I feel very proud of the team that we have, because we're really, really efficient and really good at what we do. So those are a few things. We of course, we see general dermatology where we do acne and psoriasis and really any other skin issue that people have, we can see, and we see them. We have, like I said, 22 providers, and we have, our thing is, hey, next day, same day, let's go see it.
You mentioned you have multiple locations, and one here in Canton, of course, and a new location in Lorain, and you also have one in Cuyahoga Falls. Is there anything pending here that you're going to open another one in?
No, we're very excited about Lorain. We opened that office, literally, in April this month, and then Cuyahoga Falls we open in December. So one of the things that we've done in the past is really go to places where there's need. So we are trying to find where the need of dermatology, need of their skin cancer is there, and we set up shop there. We connect with the community, we connect with local hospitals, and then we really try to help out the patients so that they don't have to wait too long to see a doctor or wait months to get cancer treated.
So why did you decide to do this, just to start Apex?
My vision was to provide a better patient experience. Even in Northeast Ohio, with so many really big good hospitals that we have here, we can still improve access for dermatology and skin cancer. So at Apex, we're trying to do that. We may not be perfect, and what happens is that people are not used to getting an appointment so fast. So when people call, they will ask you, hey, when you come at 2 today, they're like, whoa, I can't. So we continue that method.
Yeah, I scratched you a date 6 months down the road on the calendar, right?
People are not expecting that. So I think it's
God.
cool, and that's one of the reasons why we're doing it. We're trying to really change that patient experience and doing a really good job for it.
So what'd you do before you started this practice?
Well, I've had a pretty diverse background. Before I was in dermatology, I was a flight surgeon for the Marines, and
Oh, wow.
so I did a lot of overseas deployments, and I worked basically as a medical department head for a fighter squadron in the Marines, the VMFA 122, the Crusaders.
Wow, where'd they send you? Where'd you go?
We were stationed in South Carolina, and we were all over the world. You know, we did a lot of deployments in support of a lot of the theaters that this is back in 2003, 2004. I made a lot of good friends, good relationship. Still keep in touch with a bunch of them. But you know, that's what I did before, and I was living in South Carolina, and you know, we landed in Cleveland for dermatology training here at Case Western, and then I did my fellowship in Boston for the Mohs surgery, and then my family, we decided to come back to Ohio and make this our home. So we've been here now for a while.
Were you ever at McCord in Washington State?
No, I never was there.
Okay, I was in the Army there in Fort Lewis.
Oh wow! Well, thank you for your service. We did a lot of
McCord was right there beside us. It was kind of interesting. So
that's great, man. Yeah, so I had a really good career with the military, and I'm very thankful for all they did for me. And they definitely helped my career. And then listen, I don't know if we're going to talk about this, but we have the Apex Purple Heart Project, which you know, it's a project that I developed because of my passion for dermatology and my military service. We do complementary laser scar revision for wounded veterans. So we have a program where we try to help the vets get back into the game.
Super. That's great.
Very cool. So
great. Wonderful. That's very good of you.
Thank you.
Super. Well, all right, let's talk about, you know, I don't know how, it's already May. It seems like the year's flying by. And, you know, even if people have deductible issues at the beginning of the year, is it safe to assume you accept most common insurances? How do you deal with patients and their insurance needs? Or maybe you just accept patients that are looking for appointments off the insurance plans too?
You know, luckily for us, we really, every time we go to a community, we really partner with all the medical insurances in that area. So most of our patients, I would say 95+% of the stuff we do is covered by insurance. Even if skin cancer screening is covered by insurance. So, you know, most patients, they have to pay their copay normal. And then if we do a biopsy or something, then that's all covered by insurance. So luckily for us, you know, most skin cancer services are covered by insurance as well. So we do have a small part of our practice that is not insurance based. It's basically aesthetic practice. You know, if people want to get laser or Botox or fillers, that's all out of pocket because it's aesthetic. But people know that. We don't have to, you know, they expect that. But luckily for us, you know, we're partnered with most major carriers. I would say top 10 to 20 in the area, and we take most of them. So that's really never an issue. And there are some people that want to see us and that out of network. So we still see people that, you know, even though we're not in their network, they want to, you know, they like our providers or whatever. So we can still see them, but you know, they're in the out of networks phase. Luckily for us, every time we go into a community, we are partners with the hospital. So, you know, in SUMA or Cleveland Clinic or UH. So we are a part of those networks. So a lot of those patients that can see the Cleveland Clinic or UH or whatever providers, we are also considered tier 1 for those patients because we're part of their network. So it gives us really a good opportunity to treat everybody really.
Excellent. All right, well, you mentioned skin cancer earlier in the program and your vast experience. Let's talk about skin cancer. How common is it? And, you know, maybe people think that are listening today that living in Ohio wouldn't be the same thing as maybe living in Florida, but I bet you have some comments on that.
Yeah, so this is a very timely question because May is Skin Cancer Awareness Month. Actually, just yesterday, we did a free skin cancer screenings across all our locations because of, you know, we do this once every May. So I always tell people skin cancer is very prevalent. A lot of people get it because of genetics, and they're very, you know, light skin and they're doing a lot of stuff outdoors, depending on your occupation. So really, skin cancer can happen to anybody. We see plenty here in Ohio. And really at the end, I tell people it's all about early detection. So if just like anything else, if you get a little something on your face or in your back that's crusty or bleeding or something, well, don't wait, get it checked, because a lot of times these cancers are, if we catch them early, they're very easy to treat, 99% cure rate. And people are, back into their game, doing their thing. Now, when you delay treatment, obviously, then that's when you can get into problems. And then sometimes we can't help people. Sometimes we got to send people to have bigger surgeries or have chemotherapy. So really the name of the game is being proactive, being skin smart, and checking your skin and making sure you get a skin check. Or if you have something new that's kind of symptomatic, well, don't blow it off. Go check your doctor. Go check it out. Yep.
So that's an excellent point, and it leads me to a question. Maybe you've got a mole on your arm or something, or you see something that you're a little concerned about its color or shape, or is it getting bigger? What do you look for? When do people need to come see a dermatologist? What are your benchmarks for raising awareness for how your skin looks and doing a skin inspection on your own?
So there's a mnemonic for melanoma that's really easy. It's called A, B, C, D, E of melanoma. And I'm going to go through it. So A is asymmetry. So something that is not symmetric. B is borders. If you have a mole with irregular borders. C is color, different colors within a mole. D is diameter, anything bigger than 6 millimeters or a pencil eraser. E is evolving, meaning something that's changing. If it's getting smaller, it's getting crusty, it's bleeding, it's painful. If you have any of those signs, then you got to get that checked. And it's the way I explain people, it's not a very invasive procedure to have do a skin biopsy. In fact, it's just like a tiny little injection where we numb the area and we take a little skin scrape. So it's a really easy way of obtaining a tissue diagnosis, and we usually it takes 2-3 days. We get the report back, and you can check to see if you have melanoma. Now, there's two other very common skin cancers. One is called basal cell carcinoma, and the other one's called squamous cell carcinoma. Those look different. Those look more like a pimple or like a rough, scaly patch of the skin that people usually say, I got something in my cheek, I flick it off, and then next month you get it again and you flick it off again. So something that's rough or scaly or crusty, or sometimes looks like a pimple that doesn't go away. People try squeezing it, and then a pimple comes and within a month is out. You shouldn't have a pimple in the same location for 6 months. So I always tell people, pay attention to those symptoms, and if you get something like that, I don't say within a week, hey, go get a biopsy. But if you got something like that within 4 to 6 weeks and that's still kind of crusty, then be proactive. And one last thing I want to mention is that because of COVID, unfortunately, people really delayed a lot of these screenings. And we're seeing this across the whole medicine. So a lot of the things that I'm seeing now in my practice is people that waited now 2 or 3 years to get checked. And these cancers are huge. They're more aggressive. So, I encourage people that are listening today to, hey, be proactive. Don't wait. It's completely safe to go see your doctor. We have masks. We sanitize. I mean, it's super, super clean these days. So we're still wearing masks in our office, and we will continue to that. But my point is that, hey, we need to go back and really taking care of ourselves and understand that, cancer can kill you, and we gotta make sure that we're proactive with looking at skin and any other cancer for that matter.
Okay, I think our first break is here. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Did you know we offer free prescription delivery? Call your Medicine Center Pharmacy and learn about prescription delivery program. So, doctor, we're back. How often should you be screened for skin cancer? And total body or just your face or?
That's a great question. So I always tell people a good way to remember is on your birthday, check your birthday suit. So basically,
okay.
basically the recommendations is once a year. Once a year, you should have a skin check with a dermatologist. Now, if you have already had skin cancer, either melanoma, if it's melanoma, if you follow the guidelines we got to see you 3 times a year, so every 4 months. And if you've had basal cell or squamous cell, it's twice a year. So most of the time, I would say we see our patients twice a year because a lot of our patients have had skin cancer. But if you're, if you've never had skin cancer, no family history, and you just have want to have skin screen, once a year is appropriate. I do it, like just like when I go to my doctor once a year to get my physical, I get, you get a screen check, and that's very common. Luckily for us, most people have stuff in their skin. So everybody that comes in the office, they always have questions about, hey, what about this, doc? So, it's not a bad idea if you're in your 40s or 50s and you never had a skin check, maybe schedule it. But it's completely non-invasive. And
What
yes,
about
to answer your question, we do give you a gown, and it's an observation. We some people just want a spot check, but oftentimes we do a full gown, a full check. We'll give you a gown. It's an observation. We look at your scalp, look at the back of your neck, look at your feet in between your toes. It's just an observation, nothing probing. Usually takes 5 to 10 minutes, and if we identify things that we think is abnormal, that's when we say, hey, maybe this needs a biopsy. Very easy.
What about these people that get sun tanning all the time, the tanning salons? I mean, I've known 3 or 4 people in my life that looked like they're tanned leather.
I know.
And I just, this one gentleman that I was somewhat friendly with, I looked at his skin and I thought, my God, I said, you look like you should be skinned. So what do you do with these people?
I tell you, it's very prevalent in this area to do indoor tanning. And, it's been well documented that, indoor tanning, which is direct UV radiation, can cause melanoma. It makes you at a higher risk of developing skin cancer. In fact, one of the things that we've seen, and this is documented, is that you see a little bit of an uptick in skin cancer cases in the younger population, and it's because of indoor tanning. Melanoma is now the most common skin cancer, the most common diagnosis of cancer in women age 25 to 29, which is crazy. It's a crazy statistic. And melanoma is asymptomatic. You never know you had it until somebody see it and figures it. So yes. So a lot of people, we encourage people to do spray tan if they want to get a tan. But we don't encourage indoor tanning. We try to avoid people going out, getting a tan, getting blisters, sunburns. Those are all things that we know now that can get you at risk of developing skin cancer down the line. So that doesn't mean you got to live in a cave, hey, live your life, be smart. Maybe you need to get that UV protected clothing, or, wear a hat, things like that. You can still live your life, but try not to get burned,
Is certainly you would know something about these statistics. Is the tanning in America kind of falling away, or?
Well, I tell you, my experience here in Northeast Ohio is that it's a pretty. A lot of people like their tan, and there's a lot of myths out there where people need to get a base tan before they go on
vacation. Yeah, sunny
I gotta
place.
get my tan before I get tan.
Gotcha. Yeah.
So it's a lot of miscommunication out there, and again, it's one of those things that we as dermatologists try to educate our patients and tell them, listen, that's not really true. But if you want to go, look cool or whatever, then spray tan is completely fine. It's not gonna doesn't cause skin cancer, it doesn't prevent either. So I always tell people, hey, wear sunscreen, wear a hat, try to protect yourself, but it's okay to get spray tan. I mean, it's not gonna hurt you.
Okay, so let's say I have a positive biopsy. What's next?
So once you have a diagnosis of skin cancer, depending on the location and the size of the lesion, then we can tell you, listen, there's surgical treatments and there are non-surgical treatments. One of the things that I do is my subspecialty is called Mohs micrographic surgery, which is basically an office-based procedure where we remove the cancer in the office. We check the margins in the office, which is very patient-friendly. And then we can clear the cancer right there within 10, 15 minutes. And then if we need to, we stitch it up, and you in and out in an hour, you're cancer free. So it's a very, very efficient procedure. It's covered by insurance, and it gives you the highest cure rate for this because we're evaluating the entire margin and the deep edge. So Mohs surgery is really the gold standard to removing skin cancers of the face and the large areas of the trunk. It's a very good procedure. It's very patient friendly, and like I said, now there are other ways of treating skin cancer too. You can do chemo cream, you can do blue light, you can do destruction with freezing. We try our jobs as your doctor is to tell you the options, And then, depending on what you want to do, we'll steer you one way or the other. Most people want to be able to have the clear margins. So most of the time we do surgery for this, especially for melanoma and all that. Now you got something that's, let's say you're 95 years old and you got a little skin cancer in your forearm. Well, maybe you don't need to do the big Cadillac surgery, right? But, at the same time, if you're 25 and you got something on your cheek, you want to make sure that you go to a place that, will minimize the scarring, minimize the amount that you take. So there's a lot of pluses on the Mohs surgery. And that's what we do at Apex, and we do it real well.
So what's the excision process like?
The procedure, you come in, we numb the location, depending where it is. We take a little piece around the tumor, and then we put a little Band-Aid on the patient, and then we take it to the lab. In the lab, we stain it, we check it. Takes about 10 minutes, and the specimen comes out in the microscope slide. And then I look at it under the microscope, and we can identify the tumor cells and the cancer margins. And then if we still see cancer on that location, then we go back to the patient and say, hey, I got to get a little bit more at 12 o'clock. We basically create a little map, almost like a GPS of the tumor. And then we go based on where the cancer is, we go at that location. We don't make the hole bigger. We just go where we need to go. So it's very a microscopically controlled approach, which really what means is that we conserve as much normal skin as we can, but at the same time removing the entire margin of the cancer. And then after that, after you're clear, then oftentimes we stitch it up, and depending on where the cancer is in the face or in the back, or depending where it is, we put some stitches in there. Most surgeons are training in reconstruction. So we do a lot of this. We feel very comfortable with, reconstruction of the nose or the ears. So that's all part of the procedure. It's all done in the office under local anesthesia, and patients really like it because it's in and out, and it's very patient friendly.
So are not the ears one of the most common places? Cheeks, maybe the nose, any other common places?
I would say head and neck in general. High risk locations are eyelids, ears, lips, nose. But, I would say scalp is very common. The neck is very common. The hand, your driving hand, believe it or not, when you're driving,
wow,
that hand, it's that area, this area right here is always very common.
Oh, should we wear a glove on that hand?
Yeah. Well, what happens?
I did think of that once. Yeah.
Well, we talk about skin cancer, and it's documented that the left side, because the people who are drivers all the time, or we have patients that are truck drivers, that's what they do for a living. Sure. The left side of the face and the hand and the arm has a lot more sun exposure than the right side. So we see that a lot, and it's quite striking sometimes. Somebody has driven for 30 years, most of their skin cancer is on the left side.
Wow.
It's crazy.
Interesting. Well, maybe we should take a break for the news here, huh, Brad? It is the bottom of the hour and time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning, Brad and I are talking with Dr. Garcia of Apex Dermatology. We have a lot more to cover this morning, so let's get back to the show.
All right, doctor, before our last break, you mentioned a little bit about Mohs surgery. Did you have anything else you wanted to add about that procedure?
No, I was just saying that, if you're going to get Mohs surgery, just make sure you look at your surgeon's credentials. It's important for somebody to have done a fellowship training on this procedure so that they know what they're doing. They know the histology. And, when you do a fellowship, you have to do, 500 or 600 cases that year. So you get enough cases under your belt so that you feel comfortable with this. That would be my only recommendation for those patients that are doing, Google searches and things like that.
Okay. Always good to double check the credentials. I agree 100%. So we talked about skin cancer. What are some other common medical conditions that you treat at Apex?
So another big thing that we're started last year, kind of concentrate on this is our new acne clinic. So acne is very prevalent in the younger population. Adults get acne too, depending on, sports sometimes. So we're now developing this specialty acne clinic where we really try to look at the patient and do what they call the 360-degree approach to acne. Acne, as you know, has a lot of effect, not just in the skin, but also mental. There are people that, have depression or anxiety because of their acne, or sometimes because of other diseases too, like psoriasis or eczema. But, we want to make sure that our patient, when they come in, they feel that we're listening to their problem, and we try to create a customized approach to them. Not everybody, needs an antibiotic for acne. Not everybody is a cookie cutter approach. So what we try to do is really talk to the patient, see what they want to do, what they want to try, and then really tailor something for them. Some people want to do just topical lotion. Some people just want to try, blue light because they don't want to do antibiotics. Some people need Accutane. It's an important medication that's really good for acne. So our job is to try to identify and try to be partnered with the patient, and try to not just treat the acne, but also treat some of the acne scarring that happens after you have acne, which sometimes can be significant. So we have techniques like microneedling and laser procedures and peels that we can do to kind of help to combat those scars after the acne, after some of the acne scars. That's one of the things that we're doing, which is really cool. But we also see any other general derm condition. For example, in this time of year, we're going to start seeing poison ivy soon, so people are going to come in with poison ivy, and that's our poison ivy season. We see psoriasis and atopic dermatitis, which is eczema. That's year round, right? You have psoriasis. There's so many good medications right now for psoriasis and eczema that I encourage your listeners that, hey, if you haven't been to a dermatologist because you think that they're only going to give me a cream, well, think twice. We have terrific medications now that are covered by insurance that really give people 95% clearance of their skin. It used to be when I was in school, we were happy if the patient had 50% clearance. That was good. Now we're striving to 95% clearance. So there's a lot of good data on good medicines out there, which is good. What else we see? We also see, a lot of normal stuff that kids get, that warts and, athlete's foot and, fungal infections and things like that. So depending on the sport that your kids play, they may or may not get some stuff. Some people get the chin, with the football helmet, they get the chin, pimples, or they get folliculitis, or the wrestlers, they get the warts, and they kind of, sometimes they get, herpes. So, we cover all that gamut of dermatology. And then I would say that that's pretty much, that's a lot right there.
Here's what I saw 40 or 45 years ago for acne. Are you ready? Okay. Acromycin 250 one daily. Okay. Triamcinolone cream, 0.025% a pound, and a methylprednisolone dosage of 21 tablets. Okay. And they were to use those tablets in case of flares. That was on the label, meaning acne. Okay. Do we do this today?
No, that's crazy, man. Yeah, no, listen. And before then, people used to use, X-ray radiation for acne. I've had a lot of my patients that now have skin cancer of the face, and you ask them, they ask them, why do you have all this skin cancer? And I asked him, were you treated with acne, with X-ray for acne when you were younger? She's like, oh yeah, I remember going to the lights in the face.
There was a young lady sitting in my pharmacy a long time ago, and she was just coming back from having cataract surgery. And I remembered her being covered with, with acne most of her life. She was 20 some years old. I said, what happened? And she said, well, I had to have cataract surgery. And I said, what are you talking about? She said, well, they think it was because of the triamcinolone cream.
Oh, yeah. Yeah, like we try not to give obviously steroids in the eye.
Interesting. Yeah,
that is very interesting.
I just thought it was really interesting, but that was a long time ago.
Yeah. So. Right now, the way we treat acne now is different, but obviously there is some people need the antibiotic. We know the P. acnes is significant, and we know that we have to. But at the same time, there's a lot of topical treatments that right now there are combination of treatments, which is really cool. So you don't have to have 5 different creams. You can use just one. We got to keep it simple for the younger population because they can't follow instructions. So with the younger kids,
really,
cream. That's it. Okay. If you give them 5 pills and 2 lotions, they're gonna say, okay, I'm out.
All right. Well, they'd have to get it off of their cell phone, wouldn't they?
That's right. They're too busy with that, right?
Gotcha.
Yeah, you're right.
All
right, doctor, let's talk about aesthetic dermatology. Can you tell us what that is and what patients are interested in that you treat at Apex?
Yeah, so aesthetic dermatology is basically a big part of what we do, and it's basically everything that's cosmetic or for aesthetic to enhance your appearance. So things, for example, like Botox, if you've heard about Botox, and guys are now doing it, so it's called Brotox. So it's basically, Botox is basically, relaxes your muscle, gets rid of this crow's feet that people get, the forehead lines. It's very safe, very efficient. It's been going on for years, and a lot of people ask for that. That's your entry level aesthetic patient. Then you talk about fillers. Some people need, when they want to get more of a youthful look and they want to plump up the cheeks, plump up the lips a little bit. We have some fillers, hyaluronic acid and other compounds that work with that. We also have, things that are more invasive like lasers. We know that we have different lasers for different things. If you have a lot of capillaries from rosacea, we can treat that with a laser that gets rid of red. If you want to have a little bit of a photo rejuvenation of the face without having to go under the knife and doing a full facelift, we have really good ablative lasers that do that and gives you very little downtime and kind of achieve similar effects, but less money and also less downtime. We also have a really popular procedure called cool sculpting, which is basically targeting the fat. If you get a little bit of the kind of the love handles, your kind of your beer belly, so to speak. The cool sculpting is terrific. We've been doing cool sculpting for years now. It's basically a technique where you put an applicator in the area that you want to treat, and it cools the fat. And the fat has been documented that a certain amount of temperature kills those fat cells. So over a period of time, one treatment can kill 20% of those fat cells that you treated. So it's really efficient, it's non-invasive, and people love it because people come in for an hour, then leave. Within 6 weeks, you see quite a significant difference. So we're targeting that. There's a lot of things, like I said, there's a lot of new technology every year comes up with the new things, but I would say those are the most common ones that we deal with in aesthetic dermatology. Mm-hmm.
So what about your skincare line? I understand you have one.
Yeah, so a couple of years ago, we started, we created a private label. We partnered with a pharmaceutical company, and I started asking patients, hey, listen, for me, like I told you earlier in the program, for me, it's all about adding value to the visit. So if we can give you medication or stuff that you can get in our office, it saves you some time, right? So I think that we partner with this pharmaceutical company, and we develop a little skincare line where we have an acne kit that has benzoyl peroxide and has retinoic acid. We also have some sunscreens that we dispense. We did some research and try to picked a couple of common, skin diagnoses that we see and have some of that stuff for our patients that we kind of hand select. So we have rosacea, we have a little bit of moisturizer creams and things like that we have our own private label, and they can get it here in our office, and people like it, and it doesn't break the bank, so it's a convenience factor too.
Okay, very interesting. What about promotions? Do you have a promotion going on right now?
Yeah, our promotions are, we have we always have, I think it's 20% off a cool sculpting, for the first person that never tried it before. We have partner, if you bring a friend, we always have promotions of that. This month, because of Skin Cancer Awareness Month, we're having a pretty good promotion of sunscreen. We have a really good tinted sunscreen that works really well. So again, all that information is in our website. It's the apexskin.com. We have a really nice tab with aesthetics there. We tell you what the product of the month is. We're in social media and Instagram and all that. So we try to reach our patient population, our patient base, and say, hey, listen, if you have acne, try this. If you have something else, try this. And we always try to, every month we have a different promotion. May, we reserve it for skin cancer, so we do a lot of the sunscreens. Yep.
Okay.
All right, we got about a minute left. Do you want to just summarize any takeaways for good skin health here as we roll into summer and hopefully some nicer weather, and how to be safe and how to get in contact with you at your practice?
Yeah, so in summary, skincare 101, sunscreen in the morning with SPF 30 or above, and maybe a retin-A or retinol product at night. That'll keep you looking young. If you need a dermatology appointment and you want to see somebody right away, give us a call, 833-279-SKIN or apexskin.com. We have 12 locations throughout Northeast Ohio. I'm sure we have one in your vicinity. All our doctors are terrific. We pride ourselves on being the rock stars of dermatology. So we really try to make your appointment the best appointment that you've had, so you can tell your friends. And check us out on the web and social media, and like our page, and come see us anytime.
Okay. Dr. Garcia, thank you very much. Founder and president of Apex Dermatology. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Studio Arts and Glass and Genor Appraisals and Liquidations. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you next Friday right here on News Talk 1480 WHBC. Thank you very much, Doctor.
Thank you very much, Ryan.
Very interesting. Okay.